STEM 2 in sports medicine refers to hard tissue injuries. This involves any injury to the hard tissues of the body, which specifically means the bones and the teeth. You can see the different types of hard tissue injuries here are fractures and dislocations. We've also included a little bit of information on injuries to the teeth, just as a bit of an added extra. If we look at the first section of fractures, we'll see here that there's a couple of different classifications of fractures. Firstly, a fracture can either be simple or compound. And what this means is, if it's a simple fracture, that means that the fracture has not broken the skin. So there's no bleeding outside the body. So you can see here's the fracture here or here, and the skin has not been broken. So that is classified as simple. Whereas in this fracture on the right, you'll see it's called a compound fracture or an open fracture. And you can see here that the bone has actually broken and pierced through the skin. So there would be a bleeding injury there as well as the fracture. So that is one type of the classification. The other classification is incomplete or complete. Where it says incomplete, this means where the bone is cracked, but it hasn't cracked all the way through. So you can see here that that is the case. Whereas a complete fracture, so this classification, the bone has completely snapped into two or more parts. So you can see here there's a complete snap in the bone. So that is our two different types of classifications. It can either be simple or compound, and it can be incomplete or complete. To manage a fracture, and this is a specific example for any compound fractures, which means there's going to be bleeding. Clearly, you follow the DRABCD, which is done for all first aid procedures. Control any bleeding as a matter of priority, then you get to the fracture. If you were just simply treating a closed fracture, then you would skip point 2. You don't need to control the bleeding. You'd go straight to point 3, where you're literally checking for the fractures. The key to managing fractures is immobilisation. So don't move things. And this is a compound fracture to the tibia, which, as you boys would know from the preliminary course, is your shin bone. So you can see here what you need to do in terms of how to immobilise the fracture. Ideally, you won't want to be moving them at all if you can avoid that until proper medical help arrives. Okay, so that obviously here is 0.6, and you'll just be monitoring their vital signs. A dislocation is where the bone has been removed from its joint structure. You can see here there's a little picture of a shoulder dislocation where the humerus has popped out of the glenohumeral joint there. Now, just to confirm, a dislocation is definitely a hard tissue injury. There will be soft tissue damage around the joint, but in the context of our syllabus, we are looking purely at the dislocation. So that is why it's a hard tissue injury. So don't get confused into thinking a dislocation can be classified as soft tissue. It is not in our course. It is a hard tissue injury. To manage a dislocation, again, immobilisation is the key. Just try and support the person or support the dislocated area. Do not, very, very important here, do not try and put it back into place. If you can, try and splint it, but that's not vital. And you can apply ice to the injured area as long as it's comfortable for the person, and you need to seek medical advice immediately. And the last thing we'll talk about with hard tissue injuries is those involving any sort of tooth injury. You need to obviously locate the tooth, rinse it in milk or the injured person's own saliva. Do not use water because the chlorine from the water can actually damage the tooth. If there's nothing else but water, then you can use it, but that is an absolute last resort. The person can even, like we said, rinse it in their own saliva to help clean the tooth. So holding the crown, which is the white part, so the sort of the end of the tooth that doesn't go into the gum, just reinsert the tooth as best you can into its socket, and the person can keep it in place there till they get to a dentist, which is the best way to keep that tooth. If you can't reinsert the tooth into its socket because there's too much other damage going on, place it in milk, take it with the injured person to the dentist. But again, most importantly, seek medical assistance as soon as you can. So that's STEM 2, hard tissue injuries.